Welcome. We're glad you could join us today. My name is Terry Poore. I'm the Policy Director of the National Alliance to End Sexual Violence. And we're really pleased to have you with us for this virtual congressional briefing in honor of Sexual Assault Awareness Month. And we're here to talk today about the essential role of rape crisis centers, services, prevention, and recent data. Today, in just a minute, we'll hear a welcome from our president and CEO, Monica Johnson Hostler. Then we'll get into some sexual assault and rape crisis center context and data. Then we'll have some wonderful guest speakers from the field who are working on the ground with survivors of sexual assault and to prevent sexual assault. And then we'll really talk through our requests of Congress this year. And then we'll close out in just under an hour. And now it's my pleasure to turn this over to our president and CEO, Monica Johnson Hostler, to welcome everyone to the event today.
Thank you, Terry, and good afternoon to everyone. And thank you all for joining us this afternoon. As Terry noted, my name is Monica Johnson Hostler, and I have the great privilege of being the president and CEO of the National Alliance to End Sexual Violence. We serve as the voice in Washington, D.C. for the 56 state territorial sexual assault coalitions and more than 1,000 local rape crisis centers, which you'll hear from a few today, working every day in their communities to support survivors and prevent sexual violence. April is Sexual Assault Awareness Month, a time to come together, to reflect, to honor survivors, and to recognize the life-saving work of rape crisis centers across the country each and every day. Sexual violence is in the headlines far too often, especially now. The Epstein files, Cesar Chavez, Swalwell, Gonzalez, and the list unfortunately continues to grow. And when it is, survivors feel like the media attention can increase and experience greater trauma, anxiety, fear, and at the same time, it drives more people to speak up and often seek help. That means a greater demand for services, often for programs already operating at and over capacity. Rape crisis centers, are there in these moments 24 hours a day, 365 days a year, providing crisis support and intervention, advocacy, counseling, and prevention education. This is deeply, deeply personal work, rooted in compassion, trust, and a commitment to helping people heal and reclaim their lives. I'm incredibly proud of all of the rape crisis centers and the network of advocates across this country. They bring not only their expertise, but their heart to this work every single day. Our programs are not just service providers or advocates. They are employers, community anchors, and trusted hubs of support. For so many of us, this is not just a job. It is indeed a lifelong commitment. For decades, this work has been supported by bipartisan support, and we are grateful for that leadership. We need it now more than ever. The federal funding that sustains survivor services, their healing journey, and the prevention programs and outcomes is truly the lifeline of this work. And it's not just about building the funding levels, but about ensuring those resources reach each community in a timely and consistent way. As you'll hear our latest data, sexual violence remains a widespread and devastating issue for so many communities. And at the same time, many rape crisis centers are facing real uncertainty and strain. Today, you'll hear directly from those rape crisis center leaders and advocates on the ground from Wichita Area Sexual Assault Center in Kansas and from the Family Crisis Center in Bastrop, Texas. They will share what this work looks like in their communities, the challenges, the impact, the successes, and the hope. Congress possesses the power of the purse in this time is critical. We need you as partners, as champions, to ensure survivors have access to the services that they need to heal and thrive. Thank you for being here. Thank you for caring about survivors. Thank you for caring about those who do the work each and every day. Everyone has a role to play in preventing sexual violence, and we are grateful for your leadership. I'll turn it back over to you, Terry, and you'll walk us through the remainder of the briefing. Thank you.
Thank you so much, Monica. And just want to let folks know that we are recording the webinar today, and we invite you to use the Q&A function if you have questions. Please feel free to put them in the Q&A, and we will either answer them in the Q&A function, or we'll also have some time for questions towards the end. So we really invite you to engage with us today. So this February, the CDC released a new data brief on sexual violence. The National Intimate Partner and Sexual Violence Survey, or NAESV, is some of our best and most important data that looks at the prevalence of sexual violence in our country. So they released a data brief based on 2023 and 2024 data. They have a new survey collection methodology, which they feel like will be stronger and more responsive to the ways that people engage with surveys now. So that survey found that nearly half of women and more than 1 in 6 men in the United States experienced some form of contact sexual violence in their lifetimes. 21% of women, or about 1 in 5, and 3.2% of men reported experiencing a completed or attempted rape. And approximately 1 in 3 women experienced verbal sexual harassment in the workplace. Notably, this NAESV data also includes state level data, which is very useful to communities to look at how the problem can be addressed in a more local way. So we have shared the NAESV data brief with you in the chat, and we think it's an important source of information about sexual violence in our country. We also think it's important to talk about and look at the economic impact of sexual assault in our nation. Rape costs each individual survivor more than $120,000 over a lifetime. Factoring in medical expenses, criminal justice activities, and lost work productivity, sexual violence costs our economy nearly $3.1 trillion in terms of over the lifespan of all 25 million victims in the United States. So we know that federal funding for victim services and prevention is a smart, high impact investment. It's an investment that really has important returns, even though we know we do it first and foremost because we have a moral and ethical obligation of care to survivors of sexual assault. It is also a really smart move because we know that services reduce long-term costs, improve public health, and make our communities safer. Every dollar invested in services and prevention creates a ripple effect of savings and societal benefits. Services and prevention funding stabilizes families, reduces long-term health care expenses, minimizes lost productivity in workplaces, prevents people from dropping out of school, decreases homelessness, and eases the financial burden on the criminal justice system. It also fosters safer communities, empowers survivors to heal, and prevents future harm. So we're here today to talk about the essential work of rape crisis centers. And we want to tell you a little bit about how rape crisis centers work. So rape crisis centers, some are standalone programs that are called a rape crisis center or called a sexual assault program. And so that's definitely one way that you will see these programs. We know that there's about 1,000 programs across the country, but there are different formats in which sexual assault programs exist. So there are also sexual assault nurse examiner programs, or SANEs, and those are the programs that are designed to provide the forensic exam to sexual assault survivors in the immediate aftermath of a sexual assault in a way that is victim-centered. And then many programs are what we call dual programs, and those are sexual assault programs that coexist with domestic violence shelters. So you'll see that very commonly. Some rape crisis centers are part of broader multi-service agencies, like a victim services program or a family justice center or a child advocacy center. And then we have culturally specific organizations that are designed to serve specific populations with services that really meet the needs within a culturally specific context. And we also have tribal sexual assault programs. What's so important for people to understand is absolutely rape crisis centers are providing services, they're working on prevention in their communities, but as importantly, rape crisis centers are really a hub for victims of sexual assault in their communities, providing services, support, awareness, and advocacy to all survivors across their lifespan, and also providing community leadership around the issue of sexual assault. So, what do rape crisis centers do? What services do they provide? Importantly, as Monica mentioned in her opening comments, most rape crisis services are available on a 24/7 basis. So, certainly, we know people are answering hotlines in the middle of the night. Advocates are going out to hospitals or SANE programs to support survivors during the forensic exam. Advocates and volunteers are leading support groups for victims of sexual assault. And those might be at the center, but they might be at a school, at a college, at another community center, at a homeless shelter, like meeting survivors where they are. Rape crisis centers also provide counseling during the immediate crisis and when the abuse happened in the past. And you'll hear in a minute from Maureen on our team about our annual survey, and know that we could expand with more funding the availability of counseling and trauma reduction services for survivors. And they also offer victims and families guidance through the criminal justice system, importantly. Rape crisis centers don't just offer services, they save lives, but they rely on federal funding to keep their doors open. Without sustained investment, survivors will be left without support and communities will lose essential crisis response services. Okay, so now I'm going to turn it over to Maureen Gallagher on our team, who's going to talk more about our annual survey of rape crisis centers and their funding needs.
Hi, everyone. I'm Maureen Gallagher, and I'm the Policy and Programs Manager with the National Alliance to End Sexual Violence. Some of you may know, we at the Alliance conduct an annual survey of rape crisis centers. We do this obviously every year, and we wanted to share with you the data from our most recent survey, which was conducted at the very end of 2025. Our process for gathering this data is to do outreach to rape crisis centers and sexual assault programs in all of the states and territories. We do that through the network of sexual assault and dual coalitions who send the survey out to their membership. We also utilize the assistance of our culturally specific resource center partners to send the survey out to tribal programs, to culturally specific sexual assault programs that may not be connected directly with a coalition. We also do some very targeted follow-up to make sure that we are hearing from every single state, if as many as possible, and territory. And we really, this is an important exercise for us to do to hear at the Alliance what the current needs of survivors and programs are, but to also, in turn, share that information with you all and members of Congress so that you know that, what we're asking and talking with you about is rooted in what we're hearing from local programs and survivors. And so this year we had 449 completed responses, and 41 states and the District of Columbia are represented in the results. So what did we learn? I want to note before talking about the data that we have put some of the actual comments that we received from advocates and survivors through the survey, and we're also highlighting many of those stories in our social media posts this month during Sexual Assault Awareness Month. So I encourage you to check out our social media posts to hear a little bit more about what's happening on the ground. But what we found from the survey data is that programs are continuing to see decreases in funding in great numbers. So 46% shared with us that they had a decrease in funding for direct services for survivors of sexual assault in the past year. 50% shared the decrease in funding for prevention. of sexual violence and education activities, and 53% had a decrease in staffing over the last year. But of course, despite this decrease in funding, the need continues to be great. 60% of the programs told us they had a demand for sexual assault services. Nearly 60% saw an increase in demand for prevention and education activities, and 44% had an increase in demand for services for adult survivors of child sexual abuse. And when we talk about that, we're talking less about crisis response to the hospital and individuals needing assistance after immediate or very recent assault, but folks who've been assaulted as children may continue to need rape crisis services for many years after the fact. And one of the very sort of alarming data points is that 70% of programs reported an increase in demand for housing services for survivors of sexual assault. So what is the impact when we have when we have a decrease in funding and an increase in demand? Unfortunately, it means that programs are struggling, and that survivors may not always be getting the services that they need when they need it. 30%, 33% of the programs reported a waiting list for mental health and counseling services. And 50% overall have zero mental health counseling or therapy providers on staff. So they're dependent on referring to providers in the community who are also experiencing challenges and wait lists and other barriers to services. Housing is the number one unmet need for survivors of sexual assault, and that's followed by cash assistance, basic needs such as food and clothing, and mental health care. And unfortunately, what we heard anecdotally is that many programs lack the capacity for support groups, transportation, and housing resources for survivors. And I'm going to turn it back to Terry to start our next session.
Even though we know rape crisis centers are facing increased demand, less funding, and are in many ways struggling, we also know they're doing heroic, impressive work on the ground to really support survivors and lead on prevention in their communities. So I'm really looking forward to this part of our webinar today where you will hear from two programs who are on the ground doing this important work. Right now, I'd like to introduce to you Mary Stoltz, Executive Director of the Wichita Area Sexual Assault Center in Wichita, Kansas. Mary, turning it over to you.
I needed to unmute myself. Thank you for the introduction, Terry. And thank you to everyone for being here. I'm starting with this photo that is from my hometown. This is actually my grandfather's wheat field located in Colwich, Kansas, about 20 minutes northwest of Wichita. This photo was taken in 1968 when about 2 weeks after my grandfather suddenly and really tragically passed away very young. He passed away and left behind 6 young boys, my grandmother, and 19 grandchildren he never got to meet. I spent a lot of time in this wheat field as a child, and if anybody has spent time in rural agricultural areas of the US, you know that it usually doesn't take, right now you can see 4 combines. I have this picture hanging in my office and I can see 8 combines cutting one wheat field. And I was given this picture and this, the story behind the picture from my grandmother about 35 years later after it was taken. But after my grandfather passed away, he passed away in May, and obviously leaving my entire family in a state of shock. And what do we do next? And one Saturday morning, my grandma answered a knock at the door, and she said as she looked outside, she saw combines lining the road. And one of the neighboring farmers said, "Hey, Susie, we're all here to cut Al's wheat." Um, and every farmer in probably a 5-mile radius had lined up to harvest my grandfather's wheat after he had passed away, which was their entire income for the year. Um, and my grandmother, blown away by the community's kindness, um, just stood there in shock. And she said probably a half an hour later, there was another knock at the door, and it was a man named Kenny Krause. And Kenny Krause owned the local grocery store. And he said, "Susie, I don't have a combine, but I brought what I could." And he lined her table in her kitchen with enough food to feed all the farmers who cut their wheat that day. And my grandma, 35 years later, couldn't tell this story without crying. And it wasn't I'm sure it was the loss of my grandfather, but it was also the unwavering support of the community. Because tragedy happens to people every day. And what I love about this story, and I bring with me to my work, is the community couldn't bring my grandfather back. I can't make these rapes unhappen. But what I can do is show up and support people and support my community after tragedy. And so this picture serves as a constant reminder to me that we are here to be people's community in times of tragedy and in times of unspeakable trauma. I have been in the work to end sexual violence for over 20 years. I started answering the hotline and have done different roles within our agency here. At the Wichita Area Sexual Assault Center, we serve a metro area, and we also serve 2 rural counties in South Central Kansas. And I want to talk to you today about the importance of our federal funding that we get. We currently get 3 federal grants. We get VAWA, we get VOCA, and we get SASP funding. They all fund different parts of our work that are essential for us showing up for survivors anytime, day or night. These 3 federal funds are administered through our state governor's grants program, and we have a wonderful relationship with our state administrator. But we have seen some delays in these funding streams coming through. An example from this year, our VAWA and SASP grant projects start on January 1st and run the fiscal year. We got notice of funding in the first week of April. And so our agency was continuing these grant projects and continuing to fund the salaries of the staff who are working on them out of our unrestricted funding budget, which is not as big as I would like it to be. But without that unrestricted funding, we wouldn't be able to weather the delays in federal funding. We were able to keep our staff during that time, but I know other programs in Kansas were highly considering furloughing staff and stopping services because of the delay. I do want to talk a little bit about those grant projects. Our VOCA project specifically makes sure our 24-hour services are staffed and funded at all times. So like Terry said, these crimes don't happen when it's convenient and during business hours. They happen at 3 a.m. I myself have been to the hospital with a survivor on Christmas morning. We have to be there during those immediate times of crisis and tragedy. Otherwise, survivors will not have access to the long-term healing that they need, and often the immediate safety. I couldn't agree more that our programs are saving lives. I've seen it happen where we are getting survivors to safe places when they need it. So our VOCA funding is essential for keeping our 24-hour hotline, our 24-hour medical advocacy, and our 24-hour law enforcement advocacy programs running. Our SASP funding funds more of our long-term services. So Maureen mentioned that among the crisis centers they surveyed, there's 33% with a waiting list for mental health services. We are among that 33%. We have 3 full-time therapists that are at max capacity right now, and we are continuing to see a demand for service. Without our SASP funding, we would not have those long-term mental health services available. So we are so grateful for that. And the last thing I want to mention is, I started with the story of my grandfather and the community coming together for my family. I think in many ways we're trying to do what the community did there, which is when that tragedy gets told to the next generation, which was me, it was not a story of tragedy. It was a story of community. And what we would like to do is transform survivors' tragedy into stories of community for the next generation, because sexual violence will impact the next generation. And if we can intervene early and often, we can change that narrative for folks in our communities. So thank you again for having me. I am so grateful to be here. And yes, please let me know if you have any needs or questions.
Mary, thank you so much. Thank you for the work that you do every day, for the leadership you provide, and being there for survivors and building community there in Wichita. So incredibly important and also deeply inspiring. Mary talked a lot about the important work and services that her program provides to survivors. And we'll talk about each of those funding sources in detail in just a few minutes. But first, the other pillar of super important work that rape crisis centers do is prevention work. And so now I'm really pleased to introduce some speakers from the Family Crisis Center in Bastrop, Texas. Ashlyn Wetzel, who is the prevention team manager, and Gigi Thompson, primary prevention coordinator from Bastrop, Texas. We're so glad you could be with us today, and I'll turn it over to Ashlyn and Gigi.
Thanks so much, Terry, and thank you everybody for being here today. We're here to talk about the importance of continuous investment in sexual violence prevention programming. Gigi and myself both work at the Family Crisis Center in Bastrop, Texas, and our agency not only services our county, but 3 very rural counties that surround us here in Texas. We are a dual agency who services both DV and sexual assault victims and survivors. And our agency is 95% funded by grants, and a large portion of that comes from federal funding. As many of you know, sexual violence is a widespread public health issue that affects not just individuals, but families and entire communities. While response services are absolutely critical, and those people on the front line are doing the hardest, most intense version of the work, prevention is what helps stop it before it's happening. Through rape prevention education, we help the community understand topics and things such as consent, the importance of building healthy relationships, and how to develop the confidence to speak up or step in when something doesn't feel right. And that's especially important in rural communities where everybody knows everybody, and a lot of stuff gets swept under the rug. These programs are designed to shift culture, and they're not a one-time conversation. We've got to develop consistency. We have to get not just ourselves involved, but the whole community, and need their support in creating lasting change. Myself and Gigi have the unique opportunity to work in our hometown, and that helps bring a deeper understanding of our community's needs, our strengths, and of course our challenges. Everybody knows what's going on when it's your hometown, and that allows us to really have an authentic relationship with the youth that we work with, the families that we work with, and the partners that we work alongside. Because of this connection, our programming is absolutely not a one-size-fits-all, and we do a multitude of different things through our SAPCS federal grant that we receive. One of those programs that we facilitate is a youth advisory board. And this youth advisory board consists of over 30 Bastrop County high school students who are absolutely dedicated to making their community safer. They're passionate about creating change. And as youth services and school-based resources continue to decline, this work is more critical than ever, because what they do is help fill that gap between keeping prevention education accessible, keeping it relevant, and most importantly, youth-driven, because we all know that they are more likely to listen to one another than they are to listen to us. Members of the Youth Advisory Board participate in trainings and planning throughout the year. They create peer-led campaigns on topics such as bullying intervention, teen dating violence, sexual assault, and stalking, all which the goal is to foster honest connections in peer-to-peer learning. A really wonderful thing that they did was last year during Teen Dating Violence Awareness Month. They hosted a trivia night at our local theater. And what that did is that used different excerpts from pop culture, from Netflix, from TV, from movies, to spark discussion on healthy relationships. And in turn with that, challenge some of the misconceptions that the media places on dating, on relationships in general. So by investing in this, and investing in programs such as the Youth Advisory Board and sexual violence prevention, this is helping ensure that young people continue to lead these conversations and create the change that they really want to see in their community.
And not only do we have our YABs, but through partnerships with local businesses, organizations, recreation centers, we continue to expand prevention efforts across the community while also ensuring youth and adults alike have access to education and resources. We've trained groups such as our Bastrop Museum and Historical Society, Citizens on Patrol, Heart of Texas Chamber, which is one of our local Chamber of Commerce's, to recognize and respond to concerning behaviors and create safer environments for employees, customers, community members, clients, whomever they may be engaged with. At the same time, our work in local recreation centers allows us to provide free year-round programming, which is hard to come across in our area, for youth in trusted spaces where young people already gather, making prevention education accessible, engaging, and impactful. Programs like Discovery Days and camps and Cooking for Change connect social, emotional, and physical health with real-life skills, building healthy relationships, supporting others, and developing self-esteem. The impact is tangible, right? For example, following one class, we had a participant approach us and shared that she is now able to identify that the relationship between her sister and her boyfriend is not one that is extremely healthy. It's actually very unhealthy. She said the boyfriend was constantly calling her sister and she could hear him yelling at her through the phone more often than not. She shared also that she idolized her sister, so this was very hard for her to grasp, and looks up to her very much. But now she knows that it is not the type of relationship she wants for herself and for those that is in her peer group. She says she plans to share what she learned during class with her when she got home that day. These programs remove barriers to access, right? And ensure that all youth, regardless of background, can participate, demonstrating how prevention education creates awareness that extends beyond the classroom. We've already stated we're a dual agency. And so one thing we consistently come across is our AVIP specialist that works with offenders of domestic violence consistently states that their clients constantly tell them that they may have had a different journey in life if they were provided information on healthy relationships and consent at an early age. These efforts help normalize conversations about safety and shared responsibility. When people feel connected, supported, and valued, and when systems work together, risk decreases and protective factors increase. Prevention means investing in belonging, safety, and opportunity, and addressing the conditions that make violence more likely. It is essential for us, reducing stress and shifting power dynamics and creating our safer community.
Prevention programming is extremely effective, but it is only doable and it is only possible when we have consistent, reliable funding. When our funding was delayed, our agency was forced to actually shift our prevention staff into advocacy roles just to maintain critical response services. While necessary at the time, this pause placed a lot of programming, trainings, and community outreach on hold, and in turn was a really significant disservice to our community and those we serve. It halted our momentum, it delayed our educational services and sessions, and it limited access to resources that help stop violence before it starts. Sustainable funding is critical to ensuring that prevention efforts continue without interruption and that communities receive the consistent support that they really deserve. By supporting these initiatives, you help create safer environments, you help empower youth and communities, and in turn of all of that, we're helping reduce violence before it occurs.
We highly encourage you to continue prioritizing funding and policies that support prevention efforts in communities like ours. Thank you for your time and your leadership and for listening to us today. Your commitment to building a future free from violence.
Thank you.
Gigi and Ashlyn, thank you so much for the important work that you do in your community and for elevating it for us today. We agree that belonging, safety, and opportunity are such an important part of involving youth, involving the business community, involving the whole community, knowing that we can all together prevent actually sexual violence from happening, help youth develop healthy relationships and understand consent at an early age. So thank you so much for your work. Thank you for elevating the importance of funding for prevention. And now we're really going to get into the details of the asks. You heard Mary mention the Sexual Assault Services Program, VOCA, the Violence Against Women Act. Ashlyn and Gigi talk about prevention funding like the Rape Prevention and Education Program. So now we're going to get into all those specific priorities for funding and policy that NAESV is really prioritizing and asking members of Congress to join us in this year. So I'd like to turn it over to Ellen Fern from our team to get us started on our justice side priorities.
Thanks so much, Terry. And hi to our webinar participants. Thank you so much. I want to say thank you so much for joining us today. I know maybe many of you had very late night in the house last night, or early morning. So thank you for spending time with us. It is humbling following Mary, Ashlyn, and Gigi, who are doing the work on the ground. But now we're going to get into the nitty-gritty of all the federal funding streams that are supporting the amazing work of advocates around the country. And the first funding stream I want to talk about is VOCA, which is the Victims of Crime Act. Maybe as many of you know, this statute was passed in 1984, and it is financed by criminal penalties, fees, and fines of convicted federal criminal activity. In 2021, the fees that were added to increase the crime victim fund includes deferred prosecution agreements and non-prosecution agreements, which was very helpful to maintain the health of the Crime Victims Fund. Each year, appropriators set a cap as to how much of the of funding can be released, and this is called the VOCA cap. And that these funds go out to every state, territory, and there is a set aside for tribes. It goes out by formula, and then each state funnels money down to provide services for crime victims. And obviously, as you heard a few minutes ago, how incredibly important this funding is for states and communities. VOCA funds about 1,000 rape crisis centers around the country to provide services, court accompaniment, mental health support, and crisis intervention. And so in the current fiscal year, 26, $1.95 billion was released from the Crime Victims Fund. The president's budget proposes 1.9 billion be released. We are asking for $2 billion to be released for fiscal year 27. We rounded up a little bit from fiscal year 26 because ultimately we need to maintain consistent and steady funding. This funding is extremely flexible, and in addition, it does provide services for all crime victims, domestic violence, victims of drunk driving, child sexual assault services. So it is critically important funding. The other thing we wanted to mention is a specific bill we would like, if you're joining us from the Senate side, we would really appreciate your offices looking to co-sponsor this. The Crime Victims Fund Stabilization Act actually has passed the House of Representatives. It passed in January with over 327 bipartisan co-sponsors. In the House, we're up to 25 bipartisan co-sponsors, but we really need to get this across the finish line. And what does this bill do? This bill adds additional funding, non-taxpayer funds from the False Claims Act. This is because since the Crime Victims Fund is dependent on federal prosecutions getting across the finish line, the funding since fiscal year 2020 has not been as robust as previous years, and it takes a long time to get these cases across the finish line. And so in order to maintain steady funding, we would like this bill, the Crime Victims Fund Stabilization Act, would allow unused funds from the False Claims Act that is would normally just be going into the U.S. Treasury to be diverted into the Crime Victims Fund for 5 years only to help us stabilize the Crime Victims Fund. So we urge you, we really are focused on the Senate to get this bill across the finish line, and we hope that you all would, Senate staff would consider co-sponsoring. The other key funding stream for sexual assault survivors is the Sexual Assault Services Program, or SASP. This is comes through the Office of Violence Against Women. It was authorized in 2005 as part of the Violence Against Women Act. Currently, the SASP is funded at $79.5 million. The president's budget proposes a cut of $1.5 million to this. And as you heard at the top of this webinar, there is an increased demand for services and a decrease in funding opportunities out there. And so we very much, we as advocates are advocating for fiscal year 27 for $100 million for the Sexual Assault Services Program. This goes out by formula to every state, territory, and tribal coalitions. It goes directly into states to fund direct services for local programs around the country, and it also funds state sexual assault coalitions as well as tribal coalitions. This is critical funding to make sure victims are receiving services. And then I'd like to just take a very quick moment to talk about other actions that we're following or lack of activity that is impacting the field. You heard a little bit about delays in funding, getting down to the grassroots level. We are very concerned also that there are grants that are being delayed out of the Office of Violence Against Women. These are fiscal year 25 grants. These are discretionary grants that still have yet to be announced. And obviously we're 7 months into fiscal year 26. The president's proposed budget is proposes a about $200 million cut in overall funding for the Violence Against Women program, which includes cuts for SAS, but it also eliminates key funding for very important programs that we care about, including underserved populations, restorative justice, culturally specific, et cetera. It also proposes eliminating 14 positions at the Office of Violence Against Women, which would greatly impact the work of the field. We're also very concerned about a proposal of consolidating the Office of Violence Against Women along with the COPS office and the Office of Justice Programs into a new Bureau of Justice Grants. The Office of Violence Against Women is a standalone office per statute. This language appears in the Violence Against Women Act, which was just reauthorized in 2022, and we are very much working against this consolidation. We don't believe it would provide further efficiencies for the field, and we've been working closely with congressional staff on this in a bipartisan, bicameral manner. And I'm going to turn it over to Terry now.
Thank you so much, Ellen. Such important, critical work for survivors is funded at the Department of Justice, and it's something we watch really carefully. At the same time, over at HHS, we have really important funding for prevention and the public health approach to sexual assault. So we want to talk through that. The Rape Prevention and Education Program, or RPE, which is housed at CDC, is a critically important source of funding for primary sexual assault prevention in our country. The Rape Prevention and Education Program is authorized as part of the Violence Against Women Act. Even though most of VAWA's programs sit at DOJ, this program sits at CDC, but it is authorized as recently as 2022, reauthorized in the Violence Against Women Act. This really provides the on-the-ground prevention to programs like the Family Services Center in Bastrop to work in their communities to prevent sexual assault. And it was funded at $61.75 million in both FY25 and FY26. It is authorized at $100 million, and we absolutely believe that our communities need the full authorization appropriated in FY27 in order to do this important work. As you've heard, just as services demand increases when sexual violence is in the news all the time, parents, communities also really seek out sexual violence prevention as well. And so we really need those programs to be resourced. And then we also care very deeply about the Preventive Health and Health Services Block Grant. It's very small. It's a $7 million rape set aside, but it was some of the very first federal funding for sexual assault in our country, federal funding, and we believe it's so important to continue the Preventive Health and Health Services Block Grant. And then when we move from CDC, and we'll talk a little bit more about what's going on with CDC around the Rape Prevention and Education Program in a minute, but moving on from CDC to the Agency for Children and Families at HHS, the Office of Family Violence Prevention and Services, we really think it is so important for this country to invest in the public health response to sexual assault. As we discussed, we have often looked at sexual assault as a criminal justice issue, and while it certainly is, and that's very important, we also know that survivors' needs around physical health, around mental health, around substance use, all those things that can be impacts of trauma aren't being addressed at the level they really need to be. So this year we're asking for funding $100 million at the Office of Family Violence Prevention and Services for sexual assault services provided by rape crisis centers, but also really building those community partnerships between rape crisis centers and behavioral health and health systems. We know that the short and long-term effects of sexual assault can really undermine a person's physical and mental health. There's a really strong research correlation there between things like anxiety and depression, but also things like high cholesterol, stroke, and heart disease. And so we really want survivors to have access to the full range of support that they need to heal and recover. So that's the Rape Crisis Services Partnerships at OFIPS. And then we have legislation that looks at this issue called the Healing Partnerships for Survivors Act, or HIPSA. It's bipartisan, bicameral legislation sponsored by Representative Brian Fitzpatrick and Representative Teresa Ledger Fernandez in the House, and Senators Murkowski and Amy Klobuchar in the Senate. And this legislation, H.R. 4510, S. 2348, authorizes $30 million to really build those partnerships between, it would be like a pilot project to build those partnerships between rape crisis centers, behavioral health, and healthcare systems that we know are so important to address the public health response to the issue of sexual assault. So just as Ellen talked us through some administrative issues that are going on at DOJ, we wanted to talk through also some issues at HHS and sort of what folks are facing in terms of the administration of these important programs. So the president's budget recommended consolidating the rape prevention education program and a domestic violence prevention program called Delta into one program and moving it to the Administration for a Healthy America. And part of that move, it slashed recommended funding in half for those programs. So it recommended a combined $38 million for both of those programs. And we are very concerned about this cut and what that might mean for this program. We know that RPE is authorized in the Violence Against Women Act, so we feel like there's a really strong legal justification for keeping that its own individual program. And we know that Congress has been supportive of continuing the level of funding at $61.75 million. Even though we're asking for $100 million, we just really think it's so important to continue funding for this really important program. We're also concerned about the reductions in force that happened at CDC last year. That's making it really difficult for programs to fully implement RPE on the ground level because their state health departments are having difficulty getting information they need from CDC. I mean, folks at CDC are working absolutely as hard as they can and are great partners in this work, but we really feel like the Injury Center needs to be fully staffed to work on RPE. And we were also really concerned last year at the elimination of the sexual assault technical assistance work at the Office of Family Violence Prevention and Services. So we really wanted to spotlight those administrative actions that are making it more challenging to do survivor services and prevention. Okay, I'm going to turn it back to Ellen now to talk about our HUD priorities.
Thanks, Terry. As you all may recall, Maureen at the top of the webinar, when one of the key statistics in our annual survey of rape crisis centers demonstrated that there was a 70% demand for housing assistance for sexual assault victims. 70%. It is the number one unmet need of sexual assault survivors. So there are three key funding streams that at HUD that assist in ensuring that sexual assault survivors have access to housing. One is the Continuum of Care grant at HUD, and within that there is a specific set aside called the Domestic Violence Sexual Assault Bonus Funds. In 26, they were funded at $52 million. In the proposed president's budget for 27, unfortunately, the program of Continuum of Care program was proposed for elimination. However, the budget does maintain funding for the DVSA bonus. We are requesting that set aside be increased from 52 million in fiscal year 27 to 75 million. We also, as part of the Violence Against Women Act of 2022, a new Office of Gender-Based Violence was created at HUD. That's currently funded at $500,000. We are requesting a small increase to $600,000 for fiscal year 27. And we also are requesting $15 million for training and technical assistance to help HUD staff implement a number of improvements and changes for housing for sexual assault survivors that are implemented in VAWA 2022. So this is key funding streams in the THUD appropriations bill that we wanted to make you aware of.
And then in the Department of Homeland Security, we want to point out the great importance of protecting survivors of sexual assault who are immigrants. And so that first and foremost, we want to ensure that no funds are used to apprehend, detain, or remove benefit requesters. So immigrants who might be beneficiaries of survivor-based relief, including things like the VAWA self-petitioner classification, the T immigrant visa status, or the U immigrant visa status. Those are trafficking visas. There's the T visa, and then U visa is the visa that is for victims of crime who are cooperating with the criminal justice system and seeing that those offenders are brought to justice. And the special immigrant juvenile classification. So those survivors who may be benefit requesters or beneficiaries, we want to make sure that they are not apprehended, detained, or removed. And we have those protections for survivors who are immigrants. We also think it's really important to track information about asylum seekers who are seeking asylum based on their experience of gender-based violence. And we also feel like it's important to make U visas more widely available. And one way to do that is to recapture unallocated U visas. In the first several years of the program, many of the U visas weren't used, and they really could be used now to help immigrant survivors. So we wanted to uplift those important issues for immigrant survivors at the Department of Homeland Security, DHS. And finally, today we wanted to lift up that we are endorsing Virginia's law, which is named after someone who was hurt by Jeffrey Epstein, Virginia Giuffre, who you may have heard of. This bill was just introduced this year, and it's designed to eliminate the statute of limitations for adult survivors of sexual abuse and trafficking to bring civil claims against abusers forward. And this is something that we're supporting and believe is very important. Okay, that brings us to the end of our specific issues that we wanted to raise with you today. And so we are drawing to the end of our hour together. I want to just lift up that we are glad to have your questions in Q&A, and we will be glad to answer those. Also, we're going to share in just a minute how to stay in touch with us. Many of you know how to be in touch with us, but we'll share our email addresses in just a minute. But first, I want to turn it over back to Monica, our president and CEO, to provide some closing comments.
Thank you, Terry, Maureen, Ellen, excuse me, Mary, Ashlyn, and Gigi for joining us this afternoon to share the data points that we've heard from our rape crisis centers across the country, the bills and policies and funding that will ensure that our advocates across the country are able to do this work. Again, that is their personal heart work with the support of our members of Congress and all of the staff who will support moving these bills and appropriations along. Thank you again, Ashlyn, Gigi, and Mary, for the incredible work that you do every day in our communities. And we look forward to continuing our partnership to work with each and every one of you to ensure survivors across this country have the supportive services they need and the resources to continue to move forward with prevention education efforts, as was so eloquently designed, that if we do the work early and often, we can change the outcomes of our community members. Thank you again for joining us, and we look forward to continued partnership.
Thank you, Monica. Thank you for everyone who joined us today for the webinar, to the congressional staff for all the hard work you do every day to uplift these issues, to our wonderful guest speakers and our team. Thank you so much. And you can see here how to be in touch with us. You have my email and Ellen's email. You have a link to our website where you can get all the information that was shared in the chat. And with that, we'll close out today, and we look forward to staying in touch with you as we work together to really uplift the needs of survivors, to uplift the needs of prevention during Sexual Assault Awareness Month, but all year long. So thank you so much. Take care, and we'll talk to you soon.